This show is sponsored by the Bank of Princeton and the University Medical Center of Princeton at Plainsboro.
An idea here, an innovation there. A new way of working in one room, a new approach to care in the next. Around every corner of the new University Medical Center of Princeton at Plainsboro, you'll find scientific breakthroughs and subtle human touches. That's what happens when you build a new hospital from the ground up. You get to keep an eye on everything, so you don't overlook anything. The new University Medical Center of Princeton at Plainsboro, redefining care.
Good evening, I'm Lou Goldstein, and welcome to another edition of Focus On. Tonight my guest is Dr. Rosemary Scalero-Moser, and our focus tonight will be on concussions, and specifically sports concussions. And one of the things that is in the newspapers and news very often is the number of student athletes and college athletes and professional athletes who suffer concussions, the symptoms and the long-range implications of concussions. And that can happen from a kid who is just starting out in a soccer or football program to a professional athlete. And it's something that is being taken at a very hard look right now by all agencies, and especially sports agencies and coaching. And we're going to talk a little bit about that. But first of all, Rosemary, I'd like to thank you very much for coming on the show.
Oh, you're welcome. I'm glad to be here.
Well, it's good to have you. It's good to have you. I want to give you a little bit about your background so everybody at home knows your expertise in this field. Rosemary has written a great book. It's called The Head of the Game. It's the Parent's Guide to Youth Sports Concussions. And basically she's been an expert in the field of brain disorders, diseases, and injuries for over 25 years. And Dr. Moser is also a licensed psychologist and board-certified neuropsychologist and rehabilitation specialist, as well as the director of the RSM Psychology Center and Sports Concussion Center of New Jersey, which is located in Lawrenceville, New Jersey. She's also the director of research programs for the International Brain Research Foundation and was a former president of the New Jersey Neuropsychological Society and of the New Jersey Psychological Association. She was recently appointed to the Centers for Disease Control, the CDC, and Prevention Expert Panel on Pediatric Mild Traumatic Brain Injury. It's very nice. She is the official concussion neuropsychologist for the Philadelphia Soul Arena football team, for those of you who have seen the Soul play, the Trenton Steel Arena football team, and the Trenton Titans pro hockey team. Dr. Moser has an extensive publishing background and has authored numerous research papers, books, chapters, articles, and the book that I just talked about, Ahead of the Game, which is a must-read for all parents who are looking into entering their children into the youth sports programs. So, Rosemary, I just wanted to, first of all, ask you, how did you become interested in the topic of sports concussions?
Well, you know, I'm a neuropsychologist, so one thing that neuropsychologists do primarily is study brain behavior relationships, and especially traumatic brain injury, so any kind of brain injury. And I was very interested in mild brain injury, and that focused, my practice focused on that. And then I was also a mother. So my youngest child, who was a son, was a big risk taker, loved heavy-duty sports, and became involved in ice hockey at a very young age. And so as a hockey mom, I would go to games and see these kids battered around and fall on the ice, and there was no physician, no neuropsychologist, no athletic trainer, no one around to really assess whether their brains were being affected. You know, it's like, how many fingers do you have? You're good. Get back on the ice. Right. And I knew at the time, this was back in the 1990s, that the NHL had instituted a program. In fact, they were pretty much the first pro organization that did for their players. And I thought, well, if there's a concussion management program for professional athletes, what are we doing for our children? Why don't we have something? I mean, aren't our kids' brains even more important, I think? So at that time, I started a program similar to the one at the NHL, adapted it locally, in fact, and that's how I became really involved in it to begin with.
Okay. I know I played sports and I coached sports, And I know I suffered a concussion or two, playing soccer, and I know the effects. But maybe we can talk a little bit about, what is a concussion, and what are some of the symptoms that parents and coaches should be looking out for?
Sure. Most people don't realize that you don't have to have loss of consciousness. You don't have to pass out. You don't have to have amnesia or forget what's happened in order to have a concussion. In fact, a concussion is technically what we say is any alteration in consciousness. What that means is any symptoms that you might have as a result of either hitting your head or even a strong whiplash or force. You don't have to hit your head to have a concussion. So if you have that strong force to the head where the brain rattles around inside the skull, any of these symptoms could happen. You could feel dazed. You could feel disoriented. You could feel confused. Maybe you have visual difficulties. Maybe you feel nauseous. Maybe there's a headache, balance problems, dizziness, light sensitivity. There's a whole host of things that can happen, but all of those don't have to happen. Even one of them can signal a concussion. And that's why it's so important for people to realize that, because I think we're becoming more aware of how to identify concussion and not saying, oh, if they can stand up straight and they can see two fingers, they're fine. That's not the case.
Right. And how do we really get individuals to to see if an individual, because a lot of times athletes will not say, I had a concussion, because they want to keep playing. So how do we get coaches and parents to be able to, tell some of those symptoms as coming off the field or just coming into the house? How do we get parents more educated on this?
Well, you're making a good point about some athletes who, they're passionate about their game and they really want to play. So there are many who will not recognize the symptoms. But remember also, when we're dealing with youngsters, they just may not know. And especially if you're disoriented, you may not have the wherewithal to recognize, oh, I have a concussion, I better tell someone. Right. So you're right, it is important for the adults involved in youth sports to be able to recognize the signs or symptoms. What's important is that I think the adults need to know that if you're a coach, if you're a parent, it's not your job to diagnose concussion. Right. It's really your job to suspect concussion. So if you suspect and say, gee, my son or my daughter or this athlete is just not themselves and something's going on, pull the student or the athlete off the field, the rink, wherever. Just pull them right off, because if you suspect a concussion, then they need to be evaluated. And I don't know if you know this, but New Jersey as well as Pennsylvania and other states across the nation have passed state laws that now require all schools that if you suspect a concussion, that student athlete has to be pulled out of the game.
Yeah, and sometimes there's impact testing, and I think that maybe we could talk a little bit about some of the testing that goes on around baseline and concussion testing, that schools are required to do.
Sure. People need to know that baseline testing or concussion testing, post-concussion testing, is really just one tool. It's not the whole package. Right. Just because a school system has impact testing or that's just one type of cognitive test that can be used for concussion assessment. That's a brand. So whatever concussion assessment that is used is one tool, an important tool, but just one tool in the whole process of management, identification management, and return to play. And that's really important. What this is baseline testing. Is basically, it's a short sample of different tests, usually 20 to 30 minutes long, computerized, that anyone can take. Usually, the ages at this point are pretty much age 10 through adulthood. And these tests they don't measure intelligence, they don't measure your achievement, how to do math or read or write or anything like that. What they measure are those skills that are most affected by concussions. So for example, if you have a concussion, you're not going to forget how to read a word. You're not going to forget that 2 + 2 is 4. Right. What's going to happen is you're going to be slower at doing those processes, or you may be forgetful of new things that come along. So your short-term memory may be a little lax. Okay. Your reaction time and your speed. So these tests measure verbal memory usually, visual memory, reaction time, attention concentration, visual motor speed. And it's a short sampling. We like to see what you or a student or an athlete looks like before they have a concussion. That's what we call it, a baseline, because everybody's different. You know, maybe my reaction time is a little below average. It doesn't mean there's something wrong with me, but that's the way I am normally. We like to know that now, because if I sustain a concussion and then I get retested and my reaction time is still a little low, we know that it's always been a little low and that really wasn't affected. So that's what that's about.
That's a good point. How do you know when an athlete is ready to return to play?
That's a complex process, and what I want to really state is it's not cookie cutter. It's not the same for everybody. Each concussion is different, each athlete is different. But what we do is we use a protocol that's based on what we commonly refer to as the Zurich guidelines. There was an international conference, there's been two. The next one is going to be actually this November. I'll be attending it in Zurich. And the experts across the world come together to decide what is the best way to identify, understand, manage, and treat concussion. Currently, at our center, Sports Concussion Center of New Jersey, what we do is the following. And first, what we do is we make sure that we test the student on one of these tests. Again, it's just one tool. If they have a baseline, then we will compare it to their baseline.
Right.
If they don't have a baseline, which unfortunately many students don't, especially middle schoolers or kids who aren't involved in school sports but may be in club or rec sports, they may not necessarily have a baseline test. What we'll do is we'll compare it to norms for their age group. So how do they compare with 100, how does a boy at the age of 12 compare to 100 general in the population of boys at age 10? Is he below average, above average? So we'll look at the norms, and then we'll follow that student as their brain heals until their scores max out and they've stabilized. So what we do is, number one, is we want to make sure that your cognitive test scores look fine. Two, and this is the most important, we want to make sure you feel 100%. Okay, no symptoms. No symptoms, okay? That you feel just the way you did before. And it's not enough to ask a student, how are you feeling? Because the response is, I feel fine.
Right.
What you need to know that student, and what I usually do is say, look, do you feel the way you feel the day before the concussion happened? Do you feel 50%, 95%, 80%? And it's so funny with kids, especially who want to get back to the sport, but they know something is wrong. They'll sometimes say, I feel about 98%, which says to me that they're still not 100%.
Right. Right.
And so the second part of it is they have to feel symptom-free. Then the third part of it is exertional testing. Exertional testing by a qualified healthcare professional, such as an athletic trainer who's certified or licensed. And what you do is you run the athlete through an exertional test where they have to get their heart rate up. It could be on a treadmill, a bike, or whatever, and make sure none of the symptoms return.
Okay.
Once they pass that exertional test, then the athletic trainer assists them in a gradual return to play protocol where each day they do a little more reconditioning, a little harder reconditioning, making sure that their symptoms don't return. So basically it's your neurocognitive tests look fine, you feel 100%, you pass exertional testing and the graduated return. And then with kids or youth, we also keep them out a little longer. We say at least 3 weeks with no symptoms. And our reason for that is the new research is showing that kids take longer to recover, and that even 30 days after a concussion, about a third of them still do not have normal levels of cerebral blood flow or brain blood flow. So we're learning more about the brain, and too many kids go back too soon and then get another concussion.
How many concussions are too many?
There is no answer to that.
Okay.
There are some people who have, one is enough.
Right.
There are some, especially professional athletes, who've had many. Right. I had a case where actually an elite female young adult soccer player had probably 10 or 11 in her history by the time I saw her. And her testing, her physical exams, everything were really 100%. Extremely bright woman, never seemed to be affected by it. That is a rare case.
Okay.
But what we say is that you need to monitor every single concussion and make sure that the athlete has really recovered fully from every concussion before they return to play. There's so many factors involved. There are, if they're a female, they tend to have more concussions. If they're young, we don't want them having 5 concussions before they even get to high school, which sometimes happens. There's a lot of risk involved, and we do know that there are enduring effects of concussion.
Right.
So although there is no magic number, there are a lot of factors involved in making that decision that include the neuropsychologist, the team or the physician involved, the parents, the student, athletic trainer. It's not an easy decision.
An idea here, an innovation there. A new way of working in one room, a new approach to care in the next. Around every corner of the new University Medical Center of Princeton at Plainsboro, you'll find scientific breakthroughs and subtle human touches. That's what happens when you build a new hospital from the ground up. You get to keep an eye on everything, so you don't overlook anything. The new University Medical Center of Princeton at Plainsboro, redefining care.
Well, you talked about some of the effects of concussions, and I know different sports like boxing is a brutal sport, and boxers sometimes are known as headhunters, and there's been many boxers who've been excellent boxers, but their lifespan has been shortened or they can't talk. Muhammad Ali is a great example of that, the effects of getting hit too many times in the head. But yet there's also a question I wanted to know is that do concussions sustained over a period of time, from your research? I'm not trying to put you on the spot.
That's okay.
Oh, yes, I am, maybe a little bit, okay. But do they affect for students more so than anybody else, young students to college-age students, their learning ability?
Well, concussions, cumulative concussions do have effects.
Yeah.
Our research has shown that even in healthy kids who have no problems, bright students not complaining of issues, those who sustained in their history 2 or more concussions were statistically different than those who hadn't on measures of attention and concentration. Now, would you notice this talking to them, or would you notice this by their school grades?
Right.
Very often not. So again, this is research that we see a
Right.
statistical difference. That says something to us. That says there is an effect. Now, likewise, is there an effect in playing sports in injuring your knees or other body parts? Yes. Does that mean you shouldn't play sports? That is a difficult decision to make. If you want to keep your child completely free, risk-free,
Right.
maybe you can put them in a box.
Or in a bubble.
And in a
right,
bubble,
yeah.
and not let them do anything. There's risk in life. There's risk in life. So what you as a parent need to do is really be careful that you're using the best equipment, that you're involved in a team that puts the child's care and health as number one, not winning as number one, that their coaches know the best techniques and skills to teach,
Right.
and that your child has a good attitude also, a really good attitude, a healthy attitude. Sports are important for kids because they help them learn how to think strategically, how to be physically fit, how to work as a team. And I think that if we take that approach, then we can make sports safe and healthy. Also, we have to change the rules of many of the games too, and it's about
Right.
time we do that.
Well, talking about changing the rules of many games, I know certain sports seem to be a little bit more high risk than other sports. And I was wondering, as you were talking, why certain sports, say like field hockey for women, men's lacrosse, they have helmets. Women's field hockey does not have helmets. And I was wondering why certain sports don't get involved with providing that head protection that's necessary. Now, soccer is a game because you're using your head. Okay, that's one of the parts of soccer, using your head. But in certain
Although there are
sports,
now headbands that they're using.
that's true. That is true. But and maybe we can talk a little bit about that. So maybe we can talk a little bit about those sports, and is there anything on the horizon to change, to make it safer for participants in those sports?
Well, helmets, that's a whole issue here. And what's really important to know is that no helmet or device will prevent concussion. Bottom line.
Okay.
Okay, and everyone needs to know that, and if you ask the helmet manufacturers, they'll tell you that. They will tell you that.
But
they
can
want
it
you to know
minimize it, though?
Well, we believe now with new research that we're doing that some helmets may be able to reduce the G-forces. And clearly helmets do help prevent skull fractures and bleeds and that kind of structural damage, so
Right.
they can help. So we believe that certain helmets now that they're developing may be able to reduce the force, and if you're able to reduce the force, you may be able to reduce the possibility of a concussion. But again, we also have individual differences. Some of us tend to be more concussion prone than others,
Right.
genetically. That's just who we are for some reason. Now with helmets, your first question, let's go back because you asked
Okay.
a whole bunch of stuff.
Yeah,
The first thing you talked about was why
Field hockey.
girls, yeah, exactly. That's a real controversy. There are some who believe that if you introduce helmets into the sport,
Right.
that people will be more aggressive at play, which will increase the risk of concussion. So there are those proponents, where there are others who say, no, we should, and we need to protect heads. I'm not sure which one is correct. I can't make that decision. But I can understand that as equipment gets better,
Right.
as players get bigger, we seem to be more aggressive in our play. So there seems to be a correlation there. So in some way, we need to be able to use bigger and better equipment and make players and coaches and all those involved understand that we have to reduce the level of aggression in play.
You know what the argument sounds like? It sounds like when seatbelts were introduced into cars, the mandatory requirement to put on a seatbelt made drivers, by some studies, more aggressive on the roads because they felt they had a safety protection on. So hearing you say that just sounds like the same argument that was raised with seatbelts in cars, too.
Yeah. Interestingly, there is a program called Train 'em Up Academy. Bobby Hosea
Okay.
teaches the proper method of tackling in football. And he runs his camps without helmets
Okay.
for these boys playing football. So they get to understand how they need to be safe and what's the proper way to lead and tackle.
Okay.
So that's a very interesting concept, that when you start playing without a helmet, you become a little more careful about how you play and about using proper technique.
Okay. Okay. Is there any best way to recover once you've had a concussion?
If you have a concussion, or if you suspect a concussion, first of all, immediately remove the student from play. What happens too often is we're not sure and they continue to play and then they get another hit. And that second hit does not have to be the kind of hit that would normally cause a concussion, but the second hit makes the whole concussion even worse than it would have been.
Okay.
So it may evolve into a post-concussion syndrome or long-term recovery, or in certain cases, which we have seen, not frequent, but enough to be cautious, second impact syndrome, where the athlete may suffer immediate, irrevocable damage to their brain or death. So the first thing to do is, as soon as you suspect a concussion, no more play. Get them out, get them reviewed by a physician or a healthcare professional in concussion to be sure that there's nothing more going on, like a bleed or a skull fracture. And once it's been diagnosed, yes, it's a concussion, it's not something else that could be more serious, then rest. Comprehensive rest is the most important thing. That means going home and no TV, or minimal TV, but not really visually, kind of just listening for a little while. No computer. No texting, no Facebook, no PlayStation, no Xbox, video games, no calling up friends, no having friends come over the house, no traveling anywhere, no physical activity, no sports, no reading, no homework, no school, no work. All of
No
that.
life.
Okay. Yes, I term it social suicide for adolescents. But we do know this. If you do that comprehensive rest and you do it immediately following the concussion, you can possibly cut down your recovery time on the average of 25 days.
Oh, wow.
Yeah. Think of it this way. If you broke your arm, you'd put it in a cast and you wouldn't use it.
Right.
Okay. You can't put your head in a cast, can't not use your brain. Your brain works 24 hours a day. It masters everything you do, whether your heart beats, how your stomach growls, how you feel. So it's got to work all the time.
Okay.
How are you going to let it rest? Well, all you can do is cut down the workload, cut down the exertion. You do that by resting comprehensively in the manner that I've just discussed. And if you can do that, then you can let your brain heal itself, because there's a whole chemical cascade that happens in your brain that sometimes takes days before it reaches its peak. In other words, it's not uncommon for a student to feel fine after they get, oh yeah, I've just a little daze, but now I feel good, and then the next morning have the symptoms.
Right.
The next morning. I kind of, maybe it's a bad analogy, but I think of it this way. Have you ever found a black and blue on your arm and don't know where you got it from?
Yeah, sure.
Okay,
sure.
right. At the moment that you struck it, it hurt. Then you forgot about it. But clearly, 3 days later, it was still healing. It
Right.
was still there.
Right.
So your brain takes a while to heal, even though you may not realize it.
Okay. And I know we're getting short on time, but I just want to ask one question. Why do we hear more about concussions now than we ever have in the past?
A number of reasons. One, which I think is excellent, is the media has really brought it to the fore. So it's hard to watch any game on TV without hearing about who's sidelined because of concussion. So that is really important. Also, when you think about it, in terms of my generation, maybe yours,
Right.
more girls are playing now. Kids are
Absolutely.
starting earlier than ever. We have 3-year-olds running around on a soccer field, you know. So
Right.
kids are starting earlier. They play year-round, and they play multiple sports. If you increase athletic exposure, you're going to increase the probability of concussions, and you increase them earlier on in youth.
Okay. Well, you know, we've talked a lot about it today, and I know the book that you wrote is a primer for anybody who has a child in youth sports, and even for any pro athlete. It's a must-read. There's a foreword by Representative Bill Pascrell, who's very involved with brain injury down on Capitol Hill, Washington. It's a great book. For those of you who haven't read it, I don't know why you haven't read it. Especially if you're involved in sports, whether you're participating or you're a parent or you're a pro athlete, especially if you have kids as a pro athlete, this is the guide that you want to read. And it tells you everything about youth sports concussions, what you should look for, what you should try to prevent, and why you should stay away from a win at all costs attitude, because sports-related concussions, as mild traumatic brain injuries, have become epidemic throughout the nation, and I think as many as 63% of high school students have had at least one concussion during the course of their sports career. So if you haven't gotten the book, please go out and get it. It's a great book. It's Dr. Rosemary Moser, Ahead of the Game, The Parent's Guide to Youth Sports Concussion. It's available. It's out there. Go down to Barnes & Noble, pick it up. And if you are in Lawrenceville, drop by Dr. Moser's office, make an appointment with her. And if you have any questions about concussions, she is the person to see. So drop by her office, make an appointment. If you have any questions or concerns about the health of your child, do the smart thing. Don't wait. Don't hesitate. Go see Dr. Moser. So I'm Lou Goldstein, wishing all of you a concussion-free evening, and I hope that you have, and now we're in the holiday season, the best wishes for the holidays, the forthcoming holidays to everybody. Stay healthy, stay well, stay focused, and I'll see you next week on another edition of Focus On. Have a good evening.
This show is sponsored by the Bank of Princeton and the University Medical Center of Princeton at Plainsboro.
An idea here, an innovation there. A new way of working in one room, a new approach to care in the next. Around every corner of the new University Medical Center of Princeton at Plainsboro, you'll find scientific breakthroughs and subtle human touches. That's what happens when you build a new hospital from the ground up. You get to keep an eye on everything, so you don't overlook anything. The new University Medical Center of Princeton at Plainsboro, redefining care.